videos, we will be demonstrating the manual muscle testing to be done for patients with spinal cord injury. There are few deviations for this manual muscle testing from the standard manual muscle testing that we do with any other patient. Primarily because most patients following spinal cord injury, they acquire the spinal cord injury due to traumatic accident, and the first line of management after traumatic accidents is to stabilize the patient, to stabilize the spine. And for that, usually physicians will require that the patients maintain supine position for extended or different periods of time depending on the type of management. And that's why we need to do, and this is the first deviation for this manual muscle testing from the standard way, is that we need to maintain the patient in supine position the whole time. For the testing, as always, we start with grade 3. So we do the movement against the gravity if the patient could do it. Then we move to grades 4 and 5. For grade 4, the patient will get this grade if they can do the movement against moderate resistance, and grade 5 is when they can do it against maximal resistance. And another thing to note about manual muscle testing for patients with spinal cord injury is that we don't have pluses and minuses. And I really like this because it makes it very easy to have a clear score that different therapists will agree on. So we don't have to discuss whether it's a plus, a 3 plus, or it's a 4 minus, or whatever. It's either 3 or 4 or 5, and same for 2 and 1. So if the patient was unable to do grade 3, then we move to grades 2 and 1. And here comes the modifications in this test, because usually we flip the patient to either sidling or prone to accomplish these movements in the gravity eliminated position. But for patients with spinal cord injury, we need to keep them in supine. So we do grade 2, which is full range of motion in the gravity eliminated position. Grade 1 is palpable or observable contraction, and 0 when there is no movement. So these are the same in terms of definition. We just need to modify how we do them. The last thing we need to pay attention to when testing patients with spinal cord injury is substitution. And this happens because those patients might sometime try to do another movement instead of the movement we want. So in order to avoid being confused with our testing, we need to make sure that the patient is doing exactly the movement we are testing without any other movements, and we need to provide proper stabilization. So now we will start with the 5 myotomes for the upper limb, and then we will do 5 myotomes for the lower limb.